everyone, this is Dr. Steph Cheney from Living Health Integrative Medicine, and we have a very special guest with us today who came here for solutions for many different conditions. One of those conditions was diabetes, which he was successfully able to reverse with our functional nutritionist and our nutritional protocols. But then also there was some physical things that were going on.
Right.
I'll let you introduce yourself to the audience and sort of give everybody an overview of some of these other medical things that you were dealing with and the treatments that you had in our office.
Very well. So my name is Mike Folnick, and I'm from Chevy Chase, Maryland. And when I was in high school, I tore my meniscus playing soccer and didn't really understand it at the time and continued to play and played throughout college. But as an adult, it really started to bother me.
And that's a knee injury.
That's a knee injury.
Part of the cartilage that's in the knee.
Right.
You tore it. And that's a very common thing that happens with sports.
Very common, especially in soccer, I think, and basketball. So I was seeing an orthopedic surgeon after a period of years, and a lot of pain. It would hurt. It would just ache normally, and it would hurt in particular going up and down stairs. So the orthopedic surgeon told me I was a candidate for knee replacement, and they would happily do that. But he was concerned that I was as young as I am, and it was nice being called young. I'm 63 years old. But that it would be best if I could push off the surgery for a couple of years, because the surgeries don't last long. They only last about 10 years.
Yeah, it depends on if you listen to the device maker or the patients, but anywhere from 10 to 15 years, one joint replacement will last, and they can only do so many. So if you're in that 40 to 60 year range, and you're then confronting, having multiple surgeries by the time you're 70, that's not really a viable option. And I would imagine that the other complicating issues with confronting a knee replacement surgery is that's a major surgery, and you had not well-controlled diabetes, and you were overweight, and so there was a lot of potential for complications and post-surgical infections and things like that I would imagine they were.
I wasn't enthusiastic about it.
Yeah. The outcomes tend to be not as great depending on your health status.
So the short-term remedy was he would shoot me with a certain kind of drug that comes from the comb of a rooster as a lubricant. Okay,
so this is hyaluronic acid or Symvisc, and it basically we call that WD-40 for the joints.
It's a WD-40 for the joints. And that shot was shot directly underneath my kneecap, which wasn't a real pleasant thing to do, but that's okay. And it did work. It eliminated the aches on a regular basis. However, I still felt I couldn't go downstairs. Going downstairs somehow was a bothersome, and I wasn't able to do anything like run or jog or do any kind of long walk. So it wasn't a good solution for me.
So by the time you came to us, you were here for diabetes reversal, chronic fatigue, and then you had the arthritis or the pain, the meniscus issues so bad in the knee that exercise was out of the question. So we did a physical exam with you on our medical side.
Right, you did a physical exam, and among other things, Dr. Andrew discovered that I needed some work done on my neck because I was out of whack there, that my legs were not properly aligned, and so he developed a regimen for remedying that as well, and also told me about the stem cell.
We do regenerative joint injections in our office using stem cell therapy.
There you go.
So that was recommended. So that was recommended, and then a course of chiropractic and physical therapy was recommended, and you were already working with our nutritionists on the functional nutrition side to get your inflammation down and reverse your diabetes and get the weight down. You were getting the overhaul.
I was getting the overhaul. And that's okay. That's fine. That was okay.
That's a good overhaul.
It was a good overhaul. So it was on December 28th, the day after my birthday. I had the stem cell injections.
Great birthday present.
It was a great birthday present to myself. And I have to say that, certainly within minutes, I felt relief. And subsequent to that, I did an awful lot of additional therapy on that as part of the routine and the protocol. But within 2 weeks, I was able to walk downstairs without any kind of pain.
Isn't it nice to not have to think while you're walking downstairs?
Absolutely. I also got explanations from Dr. Andrew as to why it was I constantly turned my ankle, and things like that. And so I was very appreciative of that. And So, you know, the actual process, I came in on a Saturday, as I recall. No, I'm sorry, it was a
Probably
Thursday.
Thursday.
It was a Thursday.
Yeah.
And the doctor injected me and did multiple injections, not only underneath the kneecap, but also subsequently around to build up the muscle in the area. And the really cool thing, now he probably shouldn't tell you this, but he also did the other knee because we had excess amniotic fluid. Yeah, we had extra juice. So he also did my other knee, just in case. And I got to say that I've had subsequent x-rays about 2 months later with Dr. Andrew indicated that there was definite space between the bones. They were rubbing together before.
So you were bone on bone.
I was bone on bone, and now I've got space between.
And now you've got space, like magic.
Like magic.
Which means to us, that means you've likely grown some cartilage in that area, and the cushioning has come back.
Absolutely.
Excellent. So now we're about 6 to 8 months later. How are you doing as far as the knee
everything.
And exercise and
again, I've started back with my my personal trainer, and she's very enthusiastic about this. And by the way, she told me that they've been doing stem cell stuff on this on horses. She's done
the
horses.
Animals get everything.
Animals get everything.
They're cuter.
They said 20 years earlier the animals were still getting this, but that's okay. So she understood that, and we've done a number of exercises that she's put me onto to help strengthen the area, in addition to what I've been doing with Dr. Andrew. So I've been able to walk. In fact, take long walks. I regularly walk a 2.6 mile circle around my home, and I live near a park, and so that's been great, especially in the summertime. I just came back from vacation, and I had absolutely no issues at all. Moving luggage and other things I've had to move. Running on the beach, not a problem, and so it's all been great ever since then.
Great.
In addition to that, because I don't have that fear of pain, I've had no problem in doing things that I probably would have just shied away from in the past. So I'm very appreciative.
So overall, would you recommend this type of procedure to people that have joint pain?
I would recommend this definitely to people who have joint pain. Obviously, clearly look into this initially, and don't waste the time that I did.
Yeah, earlier the better.
Earlier
That's
the
what
better.
I always say.
Yeah.
All right. Thank you.
Thank you.